Thank you all for participating in our most recent poll, as well as thank you, Miss Valerie Worthy, for that beautiful story excerpt. And that is just a small snippet of her journey, which I had the honor and pleasure of chatting with her about during our recording for our podcast, Advocates in Action, which is launching its 11th season in June, where you'll get the opportunity to hear Miss Valerie Worthy's story fully. And there are 10 seasons worth of content that you can explore between now and June. So hop into that. I know my colleagues will share some links in the chat. And Miss Worthy's story really is a perfect segue into the panel that I'll introduce right now, that is focused on celebrating the work and the passion of three healthcare workers who are delivering care that patients need and deserve beyond the four walls of an office. So joining me today are Miss Stephanie Toney. I combined both of her names. That's fun. Stoney. If you have a child, you can name them Stoney. Miss Stephanie Toney, who is a community health worker and the visionary and co-owner at CHW Strength, which is a community health worker co-op company. Then we have Dr. Surani Hare-Kwan, who is a family nurse practitioner who has been in practice for over 25 years. She works currently in a FQHC in rural Sonoma County in Northern California, and she is also supporting our next generation of providers through supporting a postgraduate fellowship and training program. And lastly, we have Dr. Aisha Harris, the founder of Harris Family Health, a direct primary care clinic in Flint, Michigan, which is membership based so she can provide care to both insured and uninsured patients. She also roots her work in community outreach. And we want to start this conversation with setting the scene around what you all are seeing on the ground right now and your respective fields as a result of different policy changes and everything that we've been able to see and witness in this recent administration. So I would love to start with you, Asia, as what does it mean to be a community physician in a time like this? And how does that change and impact your relationship with your patients?
Yes, thank you, Ashley. I appreciate being on this panel. I'll say, as far as being a community physician, when I was in medical school, that was my goal, was to be a community physician. And I went into family medicine because I wanted to have the broadest knowledge for medical problems so I can help as many people as possible. And so for me, being a community doctor means that I'm able to help my patients directly, but I'm also aware of the things that are impacting my patients and my community overall. And so I live and work in Flint. A lot of my counterparts don't live and work in Flint. And so I see a lot of the frustrations, a lot of the great things, a lot of the developments, a lot of the challenges happening in my neighborhood and in my city that can and will directly impact my patients' care. I think it's really important for people to know that it's not only you accessing healthcare that impacts your health, but it's also the community and the work that you do, the schools that you go to, the language that you speak, the churches that you go to. All these things impact your health, and we call those the social determinants of health. And so as a community doctor, I'm able to understand what's going on the ground for my patients. So that way I'm able to better care for them in the patient room because I know what challenges and what new exposures that they might have.
And with everything happening, what are some concerns that your patients have been bringing to you most recently?
There's a lot of things that people bring to me because I see adults in men and women in general, children too. But I'll say the biggest two things right now is healthcare access because of their insurance changes. And so when people are trying to go see the doctor, when they're trying to get their medications, when they're trying to do different therapies, whatever it may be, they were using their insurance to kind of supplement the cost of those things. And with the subsidies going up, people have a lot of challenges with their healthcare access. Some people still are uninsured in general, but the subsidies overall made even more people uninsured. When it comes to their like medical concerns, a lot of people are concerned with their weight, their diabetes status, their high blood pressure status. The biggest thing that I find people concerned about is their kidney health. All those things that I already listed as far as diabetes, high blood pressure, those are the most common reason that people get kidney disease. And so I find a lot of people concerned that they're going to get that disease overall, and they don't necessarily know how to combat it and how to decrease their risk. I don't know how your community is, but my community has a lot of dialysis centers. And so people are seeing the fact that kidney disease is more prominent in their everyday life.
And Sarani, I would love to switch to you because you are working within rural communities and you have
Mhm.
been in this field for decades. So you can remember what things were like before the Affordable Care Act. And so now, as things are happening, is it reminding you of that time, and what are some unique impacts that you are seeing within the rural community?
Well, it's kind of depressing, I'll be honest. Yes, I was taking care of patients long before ACA came through. I still remember my very first patient who had health insurance for the first time in her entire adult life, sitting in front of me on the exam table, literally crying as I walked into the room because she had never seen a healthcare provider with insurance ever in her life. And it was very emotional for both of us. And I am very proud to work for an organization that provides healthcare regardless of your ability to pay. And we have taken care of farm workers, and unhoused. We have a very deep HIV population. Our community is the, if you will, more affordable place of the county. So that's where a lot of our unhoused patients end up because they can't really stay anywhere else. And we have a lot of community services. So I was actually just having this conversation with a patient a couple of weeks ago about what they're going to do. Because like Dr. Harris said, the things my patients are talking about is their inability to pay for medications because they are either going to pay for food to eat and pay for their housing, or they're going to pay for meds if they don't have insurance. So we have a lot of great programs that existed before ACA, and we'll find ways to fund them after changes in healthcare go into place. And that's how we're going to make do with our patients that can't afford their meds. It's very interesting training the next generation of nurse practitioners and PAs on how to think through these challenges because they are coming into a world of healthcare where the healthcare delivery system is going to change dramatically, and they're going to need to know how to react to that as providers as they move into their healthcare roles. So yeah, it's frightening, it's concerning, and really for me, it's about kind of going back to what we were doing before, which is offering as much as we can at the community level for free, like free mammograms and free vaccine clinics, that kind of thing, to really make healthcare much more accessible for our patients in the community. And we will see patients travel, in some cases, several hours to come get care from our clinic. It's quite remarkable.
Mhm. And you mentioned about the next generation and training them. What have you been able to see in this training? Are there new approaches, or what is this next generation being taught now to be able to be better prepared?
Well, that is a wonderful question because, in fact, we just added to our curriculum the concept of community resources. And, most speakers, when they are doing presentations, we have a lot of expert speakers come talk to our fellows over the year that they're in the program. Most of them will mention, a program here and there, but not really get into the details of that program, how to access it, and that type of thing. So our fellow faculty decided that we would present an entire course, like an entire lecture on all the community resources that exist in the state of California, regardless of where you work. So you can be a little bit ahead of the game when you settle into your clinical practice. Some of the programs we talk about are statewide, which is great, and they likely will retain funding, fingers crossed, as we move into the next couple of years. Some of them are local, so they're very hyper local. And this is where I start to educate the fellows about how to get engaged with advocacy on behalf of their patients and their clinical sites. They have to go to talk to local leadership, whether it's the mayor or the board of supervisors or the city council, or heck, even go to Sacramento and talk to their legislators, because advocacy really does matter. And people listen to us as healthcare providers because we're on the front lines of taking care of patients, and we are seeing how patients are being affected and how the loss of some grant or funding for a particular program is going to absolutely affect our patients' health long term. And so that's what we're teaching them. We're teaching them where to find the resources now with handouts, like take these with you and update them as you move into practice. And then also seek to talk to the leaders in your communities about the gaps in care for your patients and how funding really matters for future health. Because as Dr. Harris said, I always wanted to be a family nurse practitioner. I love that birth to death group of people. And I have always wanted to work in community health. It has been a passion of mine since the very beginning. And I think that everybody who's in this fellowship specifically chose it because of the training they get in rural community health, which is a beautiful thing.
Well, kudos to you all for integrating that into your training, the focus on resources and not just, a surface level, but really diving into how do you hold your patient's hand to walk them through accessing these resources. And we know that there are some people who are professionals at holding patients' hands and walking them through accessing resources, and that is our amazing community health workers. And so, Stephanie, I would love to hear from you because of the history of community health workers. It's serving as that bridge between systems and people. So I would love to hear from you over this time of this change that we have been able to see. How has the role of a community health worker changed or increased?
Yeah, that's such a great question. So, I believe the role of community health workers has expanded because communities are carrying more complexity, right? More than ever, actually. And so people aren't just trying to navigate healthcare, they're also trying to navigate housing instability, transportation challenges, loneliness, burnout, digital access issues. I mean, the list can go on, as we know. And I feel like what's changed is that CHWs, community health workers, have been previously seen as extra support, but now we are increasing in the recognition that we are essential infrastructure indeed. And so with that comes an opportunity for us to be trusted navigators, as well as educators, care coordinators, relationship builders, who are able to see the system and also help someone traverse what that means. And then the opposite of that, also doing a great job of helping the system understand lived experience. And so I'm feeling like I want to add a curse word to the list: non-compliant. We don't want to say that anymore because there's so much that goes into someone being able to show up and follow through with some expectations. And so during uncertain times, trust becomes everything. And as CHWs, we are uniquely positioned to be able to come alongside and work with the communities that we serve. And so it's also an opportunity for us to continue to be innovative in what that looks like, and continue to be a part of the multidisciplinary care team, specifically focusing on maternal health or behavioral health programs, value-based care models as well. And so as we continue to shift in that way, we can't continue to just stay focused on clinical only. We have to make sure that we're doing a good job of being with community. And so I know I heard earlier, power with, right? It's not power of or power to, power over, it's power with community. And so doing a good job of that is definitely where community health workers are able to come in and do that. And so I've also recently continues to be confirmed during these times that we're moving from CHWs, from being a part of like the margins to being that essential infrastructure, as well as recognizing that trust is not a soft skill specifically. It's really about that strong infrastructure that we're a part of developing. And so where we want to be able to move to is that community connectedness. And so as we do that, we are not just thinking about transactional experiences with communities that we work with, but transformational relationships that we're building. I would also add that oftentimes we continue to evolve. And so there's lots of things that are on the horizon for us as we continue to work well with community.
I love that you said transitioning from the margins to being part of the infrastructure. And you're part co-owner of CHW Strength, which I believe is one of those innovative models that are emerging to be a part of the infrastructure. So I would love for you to share a little bit about CHW Strength and how you all are really forging ahead with that mission in mind.
I love that. And so oftentimes we wear lots of hats. And so two hats that I wear is I'm the visionary at CHW Strength, and I'm also a CHW CEO, CHW worker owner at the CHW Co-op Company. And so we are a cooperative of community health workers who are working independently as community health workers, and we are running our businesses with excellence. And so it's a really great opportunity to be able to what does it look like instead of waiting for a health system to hire us, instead of waiting for a hospital system job to open up? What does it look like for us to work with service providers and community members who we already have trust with to be able to serve? So we can directly have that contract, directly serve, and we don't have to wait for someone else to hire us, and we can serve with excellence. And the cooperative CHW Co-op Company is there to support us in how we do that. What does it look like to get a contract? How do I get a business license? What do operations look like? How am I doing a good job of reporting or documenting the work that we've been doing and reporting that back to the service provider that I'm working with? And so really excited to continue to share more about what that looks like at the CHW Co-op Company to invite community health workers all across the country to join us.
Yes, and I know, Surani, you have worked
Yes.
hand in hand with community health workers as well. Your organization understands the importance, so I would love you to share anything that you would like to add as well.
I love community health workers. They're a key part of the way we deliver care in Sonoma County. We did have a whole department of community health workers prior to the last budget cuts at our community clinic, and they covered the entire West County, where all of our clinics are. With 3 clinics, and we're able to target different disease states that we wanted to focus on. So, for example, hypertension. So we had a list of all of our patients that had high blood pressure and taking medications, and we wanted to make sure that they weren't having difficulty taking their meds, getting their prescriptions, getting rides. And the community health workers were a key part of making sure that that worked. And another way that we used community health workers in the county was a nonprofit that I got involved in called the Center for Wellbeing. And we actually formed a center for training community health workers, which is still active. So we actually apply for grants to help fund that. I did a training as the medical provider on the board of directors. I did a training with the community health workers on how to take a blood pressure. So they learn how to do blood pressure with all of our blood pressure machines. They learn how to record it, and they're given a script to share with the patients. They're out there educating patients, but they have a script that they're working off of. And we are pulling people from literally every walk of life to become a community health worker. It is such an amazing power in our communities that is underutilized. So to Stephanie's point, community health workers, used to be marginalized. They are a key part of the way we deliver healthcare today. And organizations that aren't taking advantage of the community health workers in their communities should seek them out and bring them in to begin incorporating them into the way you deliver care into your communities, because it will extend your reach and it will improve the health of your patients and the communities that surround them. Because they don't just focus on the patient, they actually focus on the entire community that surrounds that patient. Family members, grocery stores, access to key services. It's quite remarkable. So I love my community health workers.
Yes. And Asia, I would love to hear from you because also a surprise for the audience. Dr. Aisha Harris is also a part of our 11th season of the podcast. So I had the opportunity to interview you about your work. And I know that, I mean, you were one of the inspirations for the title of this panel of Beyond the Visit, and sometimes people can think of their providers just being within those four walls. And that's why we have community health workers and navigators and everyone who understands a patient holistically. But I have learned from our conversations that you do a lot of work in the community as well to build those relationships, to build that trust. So what I would love to hear from you is how do you show up out of the four walls of your practice to be able to be truly embedded in the community?
I know that the title was inspired by our talk. That's great. I'll say first, I am the doctor to my patients. That is the simplest job I have is caring for the patients who come into my clinic. But I really value the opportunity to educate everyone in the community in different ways. And so I do a lot of things, but I'll keep the list probably more concise. I'm really into health literacy work. I think part of my family practice and my patient care is really trying to make sure that my patients understand what's going on, understand what I'm concerned about, understand why they're taking a medicine, why they're not taking a medicine, why that food's not helpful, why that surgery might be helpful, whatever it may be. I really try and have my patients understand health literacy and approach my care in the most kind of thorough and comprehensive way as possible. And so my patients have different education levels, with different literacy levels, different medical problems. And so I'm often trying to navigate what's the best way for them to understand something. And so that health literacy work that I started in my patient room bleeds into my community work. And so I do different health education talks from high blood pressure to thyroid disease, whatever it may be. Because I try and be a very approachable person in my community, even if the topic is high blood pressure, I might get a question about breast cancer at that topic because my community really craves health information and wants it from a trusted source. And so over the years, I think my involvement in the community has built up that trust to a point where if there's some health topic that someone kind of wants at their church, at their school, at their Girl Scout meeting, like they'll ask me to talk to the students or the adults about that topic because one, being a family doctor, I'm able to talk about a lot of things, but two, I really enjoy breaking down things and being there for people. Outside of health literacy and health education work, I do also work in like the public health and health policy space. I think doing the education is really important because it meets the person where they're at. But I also think it's really important to practice upstream medicine when it comes to like policy change and public health initiatives in our community. And so I also work with our local hospitals, our government, different nonprofits that are into advocacy work to try and broadly help my community from a bigger standpoint. So as much as I really enjoy the patient care in my patient room, the direct like community access with the talks and the events. I also enjoy being at the table doing different policy work to help my community. And I'll end by saying one of my favorite things to do is to also just support different things around the community. So there's a bunch of nonprofits, a bunch of like schools, a bunch of groups doing a lot of health initiatives and health work. And so I think it's really amazing that I'm able to just go to those events. Well, sometimes I'm a resource if they ask me a question because they might recognize me or they might ask if there's any kind of like health professionals in the audience. But I also like being present at the traditional health events like health fairs, health talks that someone's doing. We have a cancer talk that's happening in a couple of weeks that I got information on. I'm going to show up there. I'm not on the panel, but I'm going to show up because I think it's really important for people to see doctors that are caring for them, also trying to learn about the community, learn about some of the concerns, be part of the solution, and be proactive about being a valuable asset to the community, but also being an active resident. And so yeah, so I do a bunch of things, but I really enjoy being a resource for my community, so that way I could be a better advocate in the patient room as well as for the community as a whole.
And what you just said spoke directly to what Miss Valerie Worthy said in her story excerpt about we don't care about what someone knows until we know that they care. So you showing up in the community, like you said, I'm going to an event, I'm not speaking on it, but I'm like, I want to be here. That speaks volumes, right? And I think that also amplifies this concept of shared power and really like reducing those walls because so many people can, the power dynamics of, a patient in a white coat and just being in those rooms and not feeling like, maybe I know enough, right? Because you have a degree, but you truly being embedded within the community, living within the community and learning about that is just an approach that I feel like would make you more approachable to people to be able to share their concerns with you and be more vulnerable. So what I would love to do now is for us to dive into that conversation about shared power and shared dynamics and shared decision making. What does that mean to all of you in your practices and maybe also personally? And I would love to start with Stephanie. I'll start with you.
I would say shared power is an awesome opportunity for us all, right? And so we're moving away from the idea that the system or the professional or the organization holds all the answers. And instead, we're saying that communities are the experts of their own lives, right? Like it sounds so simple, but it rings so true. And so a lot of times, institutions or organizations may be doing something to a group of people, right? To a community, but we're asking for things to be built with community, right? So power with. And so for us, shared power looks like creating space for community voices, shared decisions, doing a good job with asking and listening instead of rushing off to lead. And so in many spaces, we can do a better job of honoring lived experience, and that is subject matter expertise. That is not an afterthought. That is the foundation of where we're coming from as we're listening well. And that posture of humility is going to be key in all that we do. And so, when we see this, oftentimes it could be a community health worker helping to support the outreach strategies that may be happening around the community because community health workers know the challenges that are being faced at that time. And inviting community health workers and community members to be a part of crafting what's happening and not just afterwards going to community and saying, can you check the box and say that we did a good job? No, no, no. How can we craft and build together? And so many times there are delays in what that looks like or the speed in which someone needs to move. It can be harder and it does take more work. But instead of just coming because you've received grant funding for something and you think it's best because statistics say so, what could it look like to actually listen well? And so many times we have an opportunity to do that in all that we do, and even in the small things. And then that builds up to the bigger things. And so what I would invite us all to continue thinking about is that the most effective care plans are built with communities, okay? With communities in mind, and allowing communities to already exhibit the wisdom that we hold and the resilience that we have and the solutions that we already know. Communities don't need more programs. That's usually not necessary. How can we invest in the solutions that are already built or build them if they don't exist yet? We are seeing CHWs becoming co-designers and co-leaders, as well as co-owners of that solution. And so sustainable healthcare requires shared power, as we know, but also shared leadership and shared accountability as well.
I think I can hop in right on the back of what Stephanie just said. That shared teamwork is really a key in what shared power looks like in community health. It is not a single person like the physician or nurse practitioner or PA that's delivering the care. It's literally the entire team that holds it all together so we can take care of every patient that comes through the door and give them what they need to be healthier as well as their family. So we we have a lot of incredible medical assistants. We have RNs, we have social workers, we have behavioral health therapists, we have people that help with insurance questions, like how do I get insurance? What are the insurance products that are available for me? So coordinators of all types and stripes that help us deliver the best care to our patients that's possible. So that shared power of healthcare delivery is all of us together. The combined effort that we all bring is quite remarkable and very powerful for our patients. They see us as their medical home, where they can come and share all of the aspects of their life and their health and all the ups and downs that go with that, and know that we're going to deliver what they need at the time that they need it. So shared power looks like that to me, as well as to Stephanie's point and Dr. Harris's point, getting involved with the work that's going on in your community. So being involved in the nonprofits, I specifically focus on health delivery nonprofits in my community for my time, for my spare time. So that's where I spend a lot of my extra time supporting the general community health of the place that I live, because I think it's important for the future, right? It's not just my current time period where I'm taking care of patients and, you know, we're existing on this planet Earth right now, but it's the future of when my grandkids are grown up and they're in the community, whatever it looks like in the future, hopefully better because of all the work that we've done now to help bring the entire community forward in good health. So that's what shared power means to me.
Aisha, do you have anything to add to that?
Not really. They both said really great things. I will add that I think shared power also really involves a lot of respect for what people have experienced and what their goals are. I think one thing that happens here in Flint is that we have a lot of collaborations between the hospital system, Michigan State University's public health and medical school, as well as all the community kind of community like neighborhood groups and nonprofits, and there's a lot of respect for what everyone does, like personally and professionally. But there's also this shared goal of improving the health of the community overall. And I think intertwining the community and the academic and health institutions is really important for the longevity and sustainability of different projects and initiatives.
And as we wind down this amazing panel, throughout this whole event, we've heard the importance of honoring community expertise, no effort is too small, the power of your lived experience, and how innovation and creative solutions can be birthed from the toughest times. So, what I'd love to end on is a note of hope and solidarity from all of you. So starting with you, Stephanie, you are surrounded by a network of community health workers who are dedicated to making an impact. So what innovations are inspiring you right now? Like what community efforts are working that you're like, this gives me hope for the future?
Yes, I love this question because one of my favorite words is in the question. I call myself a hope dealer. Yes, hope with an H, hope dealer. And oftentimes I'm reminded about actually, it's more like hope strategist. Someone just brought that word up to me, and I was just like, yes. Oftentimes, it is evoking that hope that's already there, right? I'm not really dealing the hope on the surface. It's really already in you, and it's kindling that fire that's there. And so, what I would say is that communities are no longer waiting on being rescued, right? We are building solutions together. Innovation is not always high tech. Sometimes innovation looks like relationships. It looks like listening. It looks like showing up consistently over time and really building and fostering that transformational relationship. The strongest innovation that we're seeing in community is ownership. And so that's a really great place to be. And that certainly excites me to be able to see relationships. It's not extra care, it's really foundational. It's absolutely necessary. It is essential, that relationship that we're having. And so people don't heal through the system alone. Maybe there can be a medication, there is rest, there is therapy, but people heal through hope, connection, trust, and support.
Hope Dealer. Love that title. So fitting for our times when people are having a loss of hope, right? And are inundated with things that they see on the news and feeling like there is no hope. So I believe we truly do need more people like you, Stephanie, who have a heart for that and a passion for that, to be that light during these times. And Asia, what I would love to hear from you is I know running your own practice as well as serving in the community in multiple ways can be a heavy responsibility. So for you, what keeps you going and committed to this work?
That is a good question. It is definitely an honor to be a doctor in the community. There's a lot of responsibility and information and access that comes with this career choice. But I think the biggest thing for me, personally, I really love science and the human body, and so I want people to understand themselves and their children and their families a lot better, so that way they can live healthier and longer lives. I think there's a lot of things always happening in the health system, good and bad. And so focusing on those good things, the modern medicine and innovative things that have come through, whether it's surgeries or medications, but also the fact that I feel like a lot more communities are focusing on the social determinants of health, because yeah, the health system's classic, like doctors, clinics, hospitals, like ambulances, all those things have been here for a long time, but I don't think the emphasis on the social terms of health has been as broad as I feel like it is now. Yeah, I learned it in medical school. I knew a little bit about it before medical school, but us looking outside of the clinic has been one of the biggest game changers to people's like health literacy, their health outcomes, their health access. All these things have happened because people have reached out of the clinic, and so my motivation and my commitment to this work is rooted in the fact that people deserve that information, that things are changing to be better like assets to people, be better resources to people. And even though there's a lot of stuff going on, I really think that people deserve to have that information, to have that access. And living and working in a place like Flint, where I'm from, coming home was an intentional choice, because I wanted to be a resource for the people who raised me, but also the community that I loved. And I think that people deserve to have good things. We've had a lot of things happening in Flint, a lot more negative press than we want, but there's a lot of potential, a lot of great things. And I want to be part of that change. I don't want to just sit back and feel like, oh, woe is me, things are just like not moving how I want. I want to be part of the beautiful things that are happening, the good things that are happening in people's lives. And for me, on a professional sense, I really love the victories that my patients have. I hold on to the small victories. I had someone come back today, having great response to some medicines and some care. But really, a few weeks ago, she told me she had great response. She's like, I feel 100% better. And it's like those things add up. And even though I have things that aren't great for my patients, those small things and those victories are what kind of keep me going, because that means that she can do great things. Like, I know what her job is. She does great things in the community, and her feeling healthier means that she can go to work and impact other people in the community. And I love that 6 degrees of separation, of just good things happening, because like I said, there is some heavy things happening all the time, but there's a lot of great things happening too. And so I like to focus on those things.
I love
And I
that.
guess I'll end it. I just to the audience, I want to say, if you're in healthcare, don't lose hope. The work that you're doing is incredibly vital to the future of this country, first of all. And there are always opportunities in the gut-wrenching changes that are happening in healthcare right now. Always opportunities. I am continually amazed by all the really cool ideas that continue to emerge, because humans are pretty amazing beings, and we come up with really great solutions. So don't minimize your ability to make an impact on your local health organization, whatever that might be, whatever that might look like. And if you're a patient, I want to make sure that you know that your community health providers, all of us, this whole group of us and many, many more, are really there to take care of our communities where we work and live, because they're important to us. We're not going away. Things aren't going to disappear just because the budget changes, because the budget changes every year. And so I just want to have everyone left with the concept that the safety net is there. Will there be holes in the safety net? Sure, but we're really good at patching up holes as a being, and so know that will be there for you now and into the future. Thank you.
Thank you all for that. I have multiple screens up. And Carissa Bishop in the chat wrote, "Thank you. I'm glad that I joined because I'm losing my hope lately." So I just wanted to say thank you to the three of you for all being hope dealers today and all inspiring us to move on and to like you said, Surani, really believe in the good of humanity, and that we have each other's back, and that there is a community that is passionate and dedicated and committed to this work. And it's evident that you all are, and so are your circles. And that is the reason why we can all have hope in times like this.